At RespShop, we cater for all things CPAP, and we stand proudly by the fact that CPAP therapy is the gold standard for treating sleep apnea, effective in around 95% of apnea sufferers that consistently use it. But we're even more committed to helping everyone with sleep apnea, whether they choose to use CPAP therapy or not. So in this video, I'm going to put CPAP therapy to the side and talk about alternative ways to treat your apnea. Coming up, Ruben here from RespShop with another video packed with useful info for sleep apnea sufferers. Keeping you informed of news, reviews, the science of apnea, therapy options, and equipment is what we do. We're on YouTube, Instagram, and Facebook too. So consider subscribing if that sounds of interest to you. As I said before, this video is about apnea treatment options besides CPAP therapy. And the first thing to say about this is that there are surgical and non-surgical options here. I'm not going to go into surgical options in detail as much because they must be done in consultation with a medical professional that knows your physicality and the causes of the apneas that you have, as these approaches are more permanent and usually far more targeted than non-surgical therapies. Surgical options range from operations to reduce the size of your tonsils, tongue, or nasal turbinates, to surgery straightening your septum, which is the bone at the base between your nostrils. And then there's also surgeries that tie the floating hyoid bone in your throat closer to your jaw to open the airway more, or surgery to reposition the jawbone altogether. All pretty serious stuff. And it's only effective if the corrected issues are at the root of your apnea condition. So if you think this might be you, then talk to your physician about your options. Other surgical options involve implants like the Inspire device. Now, if you've been on any CPAP sites, you've probably been followed by advertisements for this brand for quite a while. I know I have. And this device is implanted on the right of your chest, and electrodes are then inserted into your neck, attached to the base of your tongue. When activated, the device sends electrical pulses into your tongue, causing it to jerk forward when you're inhaling to keep it from falling back into your throat. Now, results with such devices are mixed, highly context specific, and I'd highly recommend that this is a last resort option in extreme cases and when other, less intrusive therapies have proven to not be effective for you. Like I said before, talk to your medical professional about this one. Okay, let's move on now and talk about non-surgical alternatives. On the more expensive end, you can get something called an ExciteOSA device. This is a device that you wear during the day for periods of time and increase the time that it's worn over a 6-week period. The device sits inside your mouth along the sides of your tongue and then sends pulses of electricity into your tongue, causing the muscles to tense and then relax repeatedly. The point of this is to tone the muscles in your tongue so that it's less likely to fall back into your throat and block the airway when you're asleep. Now, this therapy isn't a one-time thing. It needs to be repeated every so often after those initial 6 weeks, and part of the device needs to be regularly replaced, which can get expensive, especially as the initial device is at a price point in the region of a market-leading CPAP machine. ExciteOSA therapy can be effective against apnea from tongue collapse of a certain kind, but it's unclear whether it helps at all during periods of REM sleep where the tongue muscles relax a lot more. So make sure you only try options like this in full consultation with a medical professional, and make sure that you get further sleep tests to see whether you're getting the REM sleep that you need, rather than just trust your AHI index. Another option is to get what's called a mandibular advancement device. These devices go over your teeth and hold your jaw forward so that it doesn't slide back along with your tongue and block your airway. Cheaper ones are sold for snoring prevention that are like a one-size-fits-all. These are unlikely to help much with your apnea, but you can give them a try if you'd like. Typically though, you'll go to a dentist who will first scan your teeth and then have one custom made to fit snugly over your teeth and hold your jaw in place. These devices also tend to come with a way to adjust the position where it holds your jaw so that you can balance effectiveness with comfort. A more simple way to avoid jaw and tongue slippage is a cervical collar. If you lie on your back and you're prone to have your head droop down so that your chin falls back towards your throat, you can keep it in place by wearing a collar made of foam that goes around your neck and prevents your head and jaw from dropping. It also keeps your neck elongated, which helps to keep your airway open. Another way to help keep your airway open, but this time your nasal airway, is to get a nose strip. Now, these strips of tape go over your nose and they flex outwards to keep your nostrils open. This can help you avoid nasal collapse at night and with congestion issues as well. Now let's talk about positional prevention methods. It's known that sleeping on your back, or sleeping supine as it's properly called, is the worst sleep position for apnea sufferers, as gravity works to pull your tongue and neck tissues back into your throat, which isn't good. Several options are on the market here to break the habit of back sleeping and encourage side sleeping, which is far better. These range from simple but oftentimes effective physical obstructions like a t-shirt with a tennis ball sewn into the back, to electronic devices that vibrate when you're on your back to encourage you to automatically reposition yourself to stop the vibrations. Hey, shock therapy works for dogs, might as well work for us. Or a mini backpack to wear in bed. Another way to avoid gravity working against you is to sleep on a slightly elevated incline. Now, this doesn't mean you need to go out and buy an expensive bed that can do this for you through a remote, although if you have the funds, then by all means go ahead. But instead, you can just invest in a wedge pillow or even just put some cushions under the mattress to produce a slope to sleep on. Now, the angle here only needs to be between 20 and 30 degrees, and that should make a big difference. Now, my final set of suggestions are about routine and lifestyle. If weight is a cause or a partial cause of your apnea, losing even a few pounds can really help reduce your apnea symptoms. Sometimes this can be difficult as sleep apnea is a known contributor to weight gain. But if you can manage it, losing weight is an excellent way for many people to reduce the effects of sleep apnea without CPAP therapy. Other lifestyle changes that can help here include avoiding eating and drinking, especially alcohol, too close to when you go to bed, as this keeps your digestive system active and that makes it harder to sleep. And if you smoke or vape, this can have a negative impact on your apnea symptoms too. So reducing or quitting smoking can help as well. As for some helpful routines, there are a few ways to get decongested before you sleep, which can help with apnea symptoms as well. You can invest in a nasal irrigation system like the Navage and make it part of your nightly bedtime routine. Or you can try other decongestion methods before bed like using a nasal spray, a neti pot, or simply having a hot shower. And keep your bedroom at an optimum temperature. 65 degrees Fahrenheit has been proven to be the best for sleeping for most people. Now, it is worth reminding all apnea sufferers that the methods I've mentioned are far more context and person-specific than CPAP therapy, and that CPAP therapy is still the most effective and generally reliable option for treating sleep apnea that there is. If you would like to try or retry CPAP therapy, why not give us at RespShop a call, and we'll do our best to find a machine, a mask, and a system that works best for you. But however you choose to deal with your apnea, it is in the sincere hope of all of us at RespShop that it works for you and that you too can sleep tight. Bye-bye for now.